we speak to one of Africa's most distinguished public health leaders, Professor Olive Shisana. We speak about her journey that's taken her from a rural village in South Africa through exile during Apartheid to the forefront of efforts to rebuild the country's health system, not just the country's, but combat HIV/AIDS, strengthen Africa's public health institution, and advance global health equity during the COVID-19 pandemic. She joins us to reflect on those extraordinary journeys. She has just, as I mentioned to Peter, released her autobiography, Seeing Through the Storm, Leading Through Crisis, which will be launched for the first time on the 9th of August, Women's Day. It's Women's Month, and we are honored and say good morning to Professor Olive Shisana. Professor, thank you so much for taking the time.
Well, thank you so much for inviting me.
Let's just first start. Congratulations, by the way, on that global launch. Amazon releasing that book yesterday. How does it feel? And tell us a little bit more about the book, its title, and why now, I guess, after doing so much incredible work over the past decades?
Well, first of all, let me say that I'm very thrilled that this book is actually, being launched, because it's been a work that has been going on for quite some time, really seriously from last year, February, when I left the presidency. And it's really a book that, characterizes what I have gone through in life and what I have learned in life and what lessons I like to share, with the world. For many years, I've returned from exile. I didn't speak extensively about my role in the struggle, partly because I'd already shared many of those experiences while I was in the United States, where I was an activist and I was supporting a lot of the anti-apartheid movement. My memoir actually revisits that period and reveals dimensions, of that journey that I had previously discussed. Had not previously shared with South Africans. When I came back to South Africa, I made a conscious decision to step away from politics and instead focus on using my technical and scientific skills to contribute to nation building. I believe I could make a greater impact through research, public health, and evidence-based policy. And that path also gave me a degree of independence and allowed me to contribute in a different way, but equally meaningful way. And that is what my book is all about. It talks a lot more about the sacrifices, that I made. It talks about activism in exile and what it meant to me as a person, particularly being separated from family, being uncertain about the future, and the constant demands that I had of living for a cause larger than myself. So my book really talks about the need for resilience and a willingness to put personal ambition on hold. But when I look back now, I feel it's the right time to tell these stories because they are part of our collective history, not just for me, but for us as a nation. And because younger generations, I think they deserve to understand not only the political struggle, but also the personal cause, choices, and convictions
Uh,
that shape those who live through it.
And we can get back to that in just a moment because I know, Prof, one of the things that was said at your farewell was that if evidence-based was a person, that you are literally the human, you know, aspect, or should I say manifestation of that. But you became the first Black woman to serve as Director General of Health in South Africa during President Mandela's tenure. But I want to know, beyond the symbolism, what did it mean to inherit a health system built on inequality? And what did you begin by doing in terms of reframing, reforming it as well?
Well, I must say the task was daunting. really, because we had to dismantle the entire system of separate development, which the apartheid government had created, where each racial and ethnic group had its own health system, and the resources were allocated, not according to the health needs, but certainly according to the color of one's skin. So the challenge before us was just to replace this fragmented and unequal structure and create a single equitable health system that would serve all South Africans. I must say, I was fortunate to have served as special advisor of the Minister of Health before becoming Director General. And in that role, I had to establish the Provincial Health Restructuring Committee, which really brought together representatives from the various previous administration, the apartheid administration, as well as the leaders from the incoming democratic government. A big challenge to bring people that came in from very different backgrounds. But we shared a commitment to create a health system that would reflect the values of a democratic South Africa. I think together we designed a framework for the new health system, and we did it within a year. We believe that transformation had to happen very quickly before the old divisions and vested interests became obstacles to change, which we have seen with other government departments where they really delayed in terms of transforming and they failed for a very long time to actually transform. So our goal was really a rapid reset. We wanted to integrate services, redistribute the resources, and do so more fairly and ensure that access to healthcare was determined by need rather than by race. But I must say, beyond the symbolism of being the first Black woman Director General of Health, I think the role for me, it meant taking responsibility for one of the most urgent nation building projects of the democratic era. It was about turning the promise of equality into practical reality for millions of South Africans and laying the foundation for a health system that could serve the entire population with fairness and dignity.
Prof, it sounds like quite as you say, daunting start task, but a mean feat to have achieved that in a year. But just continuing along that vein of thought, I mean, with reform, it's not just about changing systems; it's about changing mindsets. And you were at the forefront of South Africa's HIV/AIDS response at a time when there was a lot of tensions around giving life-saving medicines and defining the global justice battles of our time. Can you take us to that pivotal moment that changed the course of the fight and altered the balance between public health and pharmaceutical power? Because it was a very difficult time and lots of debates while the pandemic was growing.
Yes, it was a very difficult time because at that time we had antiretroviral therapies being available in the north and the global south. We're told that just tell people to prevent to have HIV and just care for them without any medication whatsoever. So that was one of the most pivotal moments in the struggle, really, for access to life-saving medicines. And that happened. The debate I want to talk about is the one that occurred in 1998 at the World Health Assembly, when the revised drug strategy became the focus of intense global debate. At the heart of that controversy were big questions about intellectual property rights, access to medicines, and just the growing influence of the World Trade Organization rules on public health policy, which sounded very odd that the WTO had to be telling the WHO, the World Health Organization, what they should be doing about health, which we found to be very problematic. So I served as a lead negotiator for a small group of African countries, including South Africa, Namibia, Zambia, Botswana, and Zimbabwe. And we're determined to ensure that the low and middle income countries could obtain affordable medicines for their population. And at that time, HIV and AIDS was devastating communities across Africa. Yet many of the medicines that could save their lives remained beyond the reach of those who needed them most. People were dying in large numbers. So the negotiations revealed deep divisions between the developed and developing countries. We saw that the North and the South stood on opposite sides of what was ultimately a life and death issue. On one side were arguments centered on the protection of patents and commercial interests, and on the other were countries confronting public health emergencies and seeking the flexibility to provide treatment to their citizens. I think the challenge was to bridge sharply competing political, economic, and technical positions while keeping the focus on human lives. Drawing on our negotiation skills, our technical understanding of public health policy, and our long standing engagement in the Third World Movement, I think we worked tirelessly to build alliances and shape consensus. I think what made that moment more significant was that it helped shift the global conversation from viewing medicine solely as commercial products to recognizing them as essential tools for protecting the right to health. In my view, it affirmed that public interest and human survival must take precedence over private profit that nations face, especially when they have a public health crisis. But looking back, the battle was about far more than HIV and AIDS. I think it altered the balance between public health and pharmaceutical power by establishing the principle that intellectual property rights cannot be pursued in isolation, from the health needs of millions of people. It was one of the defining global justice struggles of our time. And I'm very proud, to have played a role in ensuring that the voices of developing countries were heard.
Prof, just from what you're saying, and there are victories, but some challenges still remain. I mean, if we look at the fact that the PB, PABS, that is a pathogen access and benefit sharing bill acts were, came to a very final and victorious point at the WHA last year, I think it was, but also taking that and juxtaposing it with what we saw, the vaccine hoarding during COVID-19, and you are also an advisor in the presidency around these issues. So there are obviously lessons to be learned, and you have been central to that. The rebuilding of the health architecture, not only on a regional basis, but at a health basis. What are some of the issues that are preventing us from making long lasting, you know, gains, particularly the critical moments that are presented during these phases that I mentioned?
Yeah, I think one of the biggest challenge that we have in Africa is that we don't invest a lot in what I would call sovereignty, having the ability to invest locally to manufacture medicines, to manufacture vaccines, diagnostics, and other essential health commodities. I think we don't we didn't learn as much as we should have. That COVID-19 pandemic demonstrated those risks of depending almost entirely on external supplies. Demand is global and supplies are limited. I think we as a continent of Africa, we really need to rely primarily on our domestic production, not so much on the imports of the products, which are very critical for our lives. I think Africa should build on some of the gains that we secured through that global negotiations at the World Health Organization, which really talks to also the challenges that we have with the PAPs, making sure that at the end of the day, we are able to share information but benefit, from that particular sharing. And also, we have to benefit from the flexibilities that were embedded in the TRIPS agreement, because all of these PAPs are all related to the TRIPS agreement. the trade and related aspects of intellectual property rights, which allow countries to protect public health and improve access to essential medicines during these times of needs. Now, I can say that, these provisions were hard won and should be used strategically to strengthen the continent's health security. We have to work very, very hard. Um, yeah, we really have to work hard at this.
You have been a champion of universal health coverage, but I also want to reflect on your work at the Africa CDC as well as the AU. You championed the Convention to End Violence Against Women and Girls. Speak to us about not only how your leadership has been tested, but also bringing your humanity, your agenda to these issues so that they not only encourage young women out there, but also, bring to the fore the respect that every woman in a leadership position deserves, because it can be challenging sometimes. Speaking up is seen as being aggressive. These are the microaggressions that are used in language to describe women in such powerful but very demanding positions.
Yeah, we one of the things that I had to do when I joined President Cyril Ramaphosa early on was the total shutdown protest that was happening across the whole country. Women were protesting, from Parliament. They were protesting in Parliament. They were protesting in the Constitutional Hill, and then they ended up at the Union Building, and they would not leave those women until they've really given the demands to the president. And there were 24 demands that they wanted. And one of them obviously was the question that they needed a gender-based violence summit. And that summit was to address the big problems that women were experiencing. They felt they were not heard, that they were crying, but they were not heard. Governments were not hearing, Parliament was not hearing. Uh, the judicial system in the country was not fair toward women as far as they were concerned, because there were no laws that actually protected women against gender-based violence. So when that happened, we had to convene a meeting at the Union Building, and that was very challenging. I must say, for the first time, I had to deal with the competing demands of civil society, some of them saying men cannot be part and parcel of this discussion, and others saying we women have to be the ones that are leading. We don't want men to be part and parcel of this. But we sat down and we worked with civil society. We created a structure where the civil society representative, the Department of Justice representative, and myself from the presidency sat down and say, we need to convene a summit, and we organized a summit together with all the development partners in the country, the civil society, the different government departments. Consequently, we created a platform, and that was that summit where all of the people came in to discuss, which ended up in developing a strategy for gender-based violence. But we didn't stop there. We wanted it to be implemented over a 10-year period and wanted to extend our experience also to Africa. So we decided to really partner very closely with the African Union in terms of developing a convention to end violence against women and girls. And that convention called for a coordinated effort across government, civil society, and the international partners to eliminate gender-based violence, but also to promote community-based prevention strategies so that we could also strengthen the support systems for survivors and demand that accountability, particularly from governments, and also making sure that the health, the social welfare sector, and the justice sector are really working hard to deal with this gender-based violence. Now, I was very happy that finally it was passed. I was happy to be one of the people that went to the African Union when it was supposed to be debated and discussed. Unfortunately, my plane had to leave a little bit earlier, and I failed to have that moment of ululation for what it is that we have worked very, very hard. But I'm very happy that, that convention provides a strong legal and policy framework that aims not just to support survivors, but
Okay.
to also hold perpetrators accountable.
Prof, I know we've barely touched the surface of your memoir, and I'm sure there a lot to learn from seeing through the storm, leading through crisis. That's Professor Olive Shisana's autobiography, which is going to be launched this Sunday, the 9th of August in Makatopong, which is in Limpopo. As we mentioned, she mentioned that she's been through various exiles, including forced removal during the apartheid era from her own home, to also being in exile because of the politics of the day. And she talks about herself as a young girl and the work that she's hoping will inspire other young women around the world. So we thank you for your time, Prof, and we looking forward to learn more. Professor Olive Shisana. Okay, and that brings us to just a little after 8:30. Let's take you to the newsroom for a news update. Shalani Tulongweba, good morning.